Stephen Cini,
I'm Jordan Waters.
and this is our project on the advancements in the diagnosis and treatment of diabetes. The motivations in this project for me is my grandmother who has type 2 diabetes, as well as the rising number of cases that occurs in America every year.
Also, in third world countries, it's believed that the cases are on the rise, but they are not educated on what diabetes is, so those places are equally in need of understanding of diabetes.
Before we start, we wanted to give a brief overview of what diabetes is and some background knowledge before we get into our research. The form of diabetes we'll be looking at is called diabetes mellitus, as opposed to diabetes insipidus, which is a separate condition. When people mention in America diabetes, they usually refer to diabetes mellitus, as it refers to hyperglycemia, and it refers to the lack of insulin in the body. There are many different kinds of diabetes. Type 1 is where it's a genetic modification that causes absolute insulin deficiency. Type 2 is a progressive autoimmune response where it could be caused later in life due to, it's usually coupled with insulin resistance, and it happens where there's a partial attack of the beta cells as opposed to in type 1 where it's a full attack of the beta cells. Gestational diabetes occurs during pregnancy and could usually be diagnosed in the second stage. That's another common one. And then lastly, there are many other specific types of diabetes that are not as well known.
Section is going to be the results section.
For this portion of the results, we're looking at the rate of increase in cases from 1980 to 1994. The number of existing cases is in the left-hand column and the blue line, and then the number of existing cases that were reported within the last 12 months is shown by the red line. As you can see in both instances, there was a large increase between the start of the time period 1980 and the end of the time period in 1994. This next section shows how, in a report published by the American Diabetes Association in 2007 and 2020, they had roughly the same criteria for diagnosis with slight differences regarding the dosage amounts. Overall, though, most of the data and most of the criteria for that diagnosis stayed the same between these 2 years. And lastly, this shows the leading treatments between 1998 and 2007. As you can see, there are different classes, the oral treatments and then injectable treatments. The oral treatments have their uses and were found between 1984 and 2000 roughly, but most of the treatments after 2000 were injectable and in the form of insulin.
For comparisons of current treatments, we're looking at ginseng, which is a herb people are currently recommending, and there's actually conflicting studies where doctors cannot currently recommend that for diabetes. We also look at evogliptin compared to linagliptin, which is more commonly used currently, but they found that evogliptin is going to have less adverse effects according to this table here underneath. Also, we looked at numerical method controllers and PID fuzzy controllers of artificial pancreases, which help keep the glucose levels from going too high or too low. You can see here in this graph, they actually were able to, with those numbers, keep the numbers from going above 180 or into the negative, while also keeping it at around the number of 120. For new developments, they're currently working on non-invasive sensing for glucose levels through the tongue. They're also working on less stressful treatments. Like he said earlier, there's a lot of injection types, which is really hard on people to consistently be doing. So they're looking at tabulated methods of distribution and also patches through the skin. Alongside controllers, instead of just having numbers predictions, they're doing machine learning where the machine actually learns how to respond to the body throughout the day instead of just based off of guesses. And they're also looking at herbal drugs because there's potentials in a lot of naturally found plants. For example, candy leaf actually stimulates insulin secretion itself. And outside of medicine, there's a lot of focus on things like self-care and the patient's attitudes, because how they perceive the medicine, just like the stress related medicines earlier, is going to affect how they're going to take it and the effectiveness of the drug. Another thing along those lines is actually informative games for kids that they've been making to have it be fun for the kid and also introduce them to how they should be actually taking their medicine at the same time. Cognitive training is something you'll see here on the table on the right. There's a lot of things like depression and like loss of memory that comes alongside it. So they're working on using smartphones or other methods to actually encourage using your brain and practicing those functions more. And there's also looking into the potential treatment with marijuana, and they believe that there could be prevention of diabetes and also help with it. So in conclusion, we actually have the difficulty of creating new medicines, as some research shows, for diabetes, but there's been tons of improvements to current treatments of diabetes, and they're currently focusing on making treatments available to people in hard to reach areas. And they're also trying to help people better understand the medicine to help its effectiveness. And although there are some prospects, it's very important that people understand the medicine now, and that they understand what is currently available and how well it works. And then we're going to talk about our future work.
Some of the things that we could do in the future regarding the project is it would depend on as technology changes. For example, as modeling improves, we'll be able to get more historical data, allowing us to see more about how these diseases originated and how they were originally treated. On the other side of the spectrum, new technology is also being developed, which to better the lifestyle of the people with diabetes. So as new treatments develop, we'd have more to look at for our research.
Also, we're looking at improving the understanding of people so they could care better for themselves by understanding the drugs better, being less afraid of it and their attitudes. So they're actually taking the medicine the way it's supposed to be taken. And also economic comparisons for being able to afford those things, those different kinds of treatments, both in America, where it's widely available, or in areas where healthcare is not widely available, like in Kenya or Cambodia. And these are some of our references.